Good morning, good afternoon, and good evening, everyone. I'm Pam Cipriano, President of the International Council of Nurses. We are so excited to bring to you today the launch of our International Nurses Day 2025 report and our NNA President Survey. So welcome, everyone. Let me first go over a few opening comments about the webinar itself. So if we go to the next slide, please. We have interpretation that's being provided in English, Spanish, and French. And if you have experience using the Zoom, please go to the bottom of your screen and activate interpretation. You will see an interpretation icon, looks like a little globe, and you would click on that and then select your preferred language. The next slide, please. Many of you are very familiar with using chat, and that's where we see greetings that are being placed already. And so please feel free to add your hellos and greetings to everyone during the webinar. But most importantly, if you have questions that you would like to have answered during the Q&A session at the end of the presentations, then please put them into the Q&A, which is also found across the bottom when you look at the icons down there. Okay. I want to just briefly mention our speakers who you will hear from this morning. We're very pleased that our CEO, Howard Catton, is with us. We also have Greg Sharplin, who is with the Rosemary Bryant Research Center, and he will be speaking with us regarding the NNA survey. David Stewart is Director of Nursing Policy and Practice at ICN. Julian Moore, part of our Communications and Policy Group at ICN, and Lisa Little, who many of you know as the first Vice President of ICN. If we go to our next slide. We are always pleased when it is time to celebrate International Nurses Day, and ICN takes very seriously that this is an opportunity not only to celebrate nurses, but to really send very strong and clear messages about what's important to support nurses. What are the urgent developments that we know are critical around the world to not only protect and promote the profession of nursing and also make sure that we are looking out for nurses, but also to promote nurses' role in global health. And we have presented our vision for change over the last 5 years in particular. So just a brief review. Again, this is a moment of action. And going back to 2020, which we all remember was the onslaught of the pandemic, we had chosen the theme, A Voice to Lead, Nursing the World to Health. And it could not have been more poignant. But we also then know that we needed to focus on our vision for the future. So in 2021, we added to that a vision for future healthcare. In 2022, we went on to address the need to invest in nursing and respect our rights to secure global health. So investment became a critical theme because we had seen that nurses were not being valued, not being respected. And certainly we were lacking the investment in positions and conditions of work. So in 2023, which was a really monumental time for us, we issued our Charter for Change. And that was a set of urgent actions that we wanted leaders in organizations and our governments to take to change policy or to put into place policy that would value, protect, respect, and invest in nurses for good health for everyone, including the health of our populations. This became our roadmap in terms of talking with our policymakers, sending messages with data to say, here's why it's really important that we must protect and promote our nursing workforce, even recognizing that there are challenges with all economic issues. So that led us to 2024, where we published The Economic Power of Care. It in itself, a powerful document to really demonstrate how important it is that we keep the people in our nations healthy, because that is an economic driver. And so the theme of caring for nurses as an economic power of care was really important. This year, we've added to the theme, caring for nurses strengthens economies. We believe it was important to recognize that if we don't have healthy nurses, if we're not affecting their well-being, then they cannot be as effective and impactful. And so caring for nurses strengthens economies is really a clear message that we want to send once again to our policymakers and our employers, because we know nurses are the key to healthy societies. So today on the webinar, we're going to hear about two critical documents. One is an important new survey of our National Nurses Associations, and the other is our International Nurses Day report for 2025. So the results of the survey, in collaboration with the Rosemary Bryant Research Center, presents information about the workforce. We know that there have been dramatic shifts and changes and challenges since 2020. And we believed it was critically important to really look at what's happening at the country level. And so you'll hear more about that, the supply in our nursing workforce, its distribution, what's happened with working conditions, and the impact of mobility and migration. We're also pleased to be able to bring to you, before International Nurses Day, our IND report for 2025. As I mentioned, Caring for Nurses Strengthens Economies. And this is where we bring critical evidence about, again, the clear economic returns of supporting our workforce, this time more specifically focused on why we must support the well-being of nurses, both their physical and mental health, as well as all the conditions that affect the ability of the nurse to work to their maximum potential. So if we just go to the next slide, we know it's important that we support nurses again. And the reason is that the pathway is clear. We support nurses, we're able to provide better healthcare, we're able to provide safer healthcare, and they really go hand in hand with strengthening the economy. So we chose Caring for Nurses as our theme because we know that while we've talked about how important it is to support well-being, that not all of our countries and not many of our places of employment are really providing the kind of support that nurses are anticipating or need, once again, to be healthy themselves and then to be able to provide the care that is needed, everything from having enough other nurses and staff to being able to know that there is investment in their well-being. We know that the world's 29 million nurses are doing incredible work. And this is, again, globally. But also we know it's important for us, ICN, to shine the light on what's being overlooked by policymakers. So we know we have not seen everyone living up to the appeal that we have made for value, protect, respect, and invest in nurses. And that's, because we know nurses will tell us they love their work, but they hate their job. And so it's important for us to really focus on that so that we're addressing the need to improve working conditions, including unsafe staffing ratios, protections in the workplace, and protection from occupational hazards, improving wages, improving the conditions that are causing burnout. So now it's time to address that crisis. And so we want you to engage with us as we have data now and compelling recommendations to make sure that we are forging the path to thriving populations and economies through the support of nursing. It is caring for nursing and nurses is the right thing to do. It has always been that case, but again, we want to be able to arm you with data that really shows the link to strengthening our economies. If we could go to the next slide. Again, you're going to hear results from two surveys. The sustainability of the nursing workforce, which is, again, from our National Nursing Association presidents, and in conjunction with the Rosemary Bryant Research Center, and then our International Nurses Day report on Caring for Nurses Strengthens Economies. And now just the next slide. I want to make sure that we recognize those who have really helped make this report come to fruition. We have our authors, Greg Sharplin, who was on the line with us, as well as Jared Clark and Marion Eckert. We had expert guidance from First Vice President Lisa Little and Jim Buchan, who's been a workforce consultant with ICN for a while. And then we have many presidents of our ICN member associations. I'm now going to turn things over to Howard Catton, who will present the results of the surveys.
Good morning, good afternoon, good evening, everyone. Delighted that you're able to join us for the presentation of our reports for this year's International Nurses Day. Next slide, please. This is going to be a little bit of a whistle-stop tour, but be assured all of these slides will be available to you. The report that I'm going to talk about is the survey of National Nursing Associations, our National Nursing Associations President Survey, conducted between July and October of last year. pretty much half of our national nursing associations participated, 68 spread evenly from right the way around the world and across all income settings. And critically, we were asking them questions about increasing demands on nurses, the supply of nurses, key indicators about the health of the nursing workforce, their pay and conditions of work. But we were asking them to tell us how they felt things were now compared back to 2021. So it's a unique survey of global national nursing associations and also giving us a sense of the trends that National Nursing Association leaders have seen over the last few years. Next slide, please. I'm going to take you first to figure 3, bottom left of the slide that you are looking at. This shows the change in the demands for nursing workforce since 2021. And you can see between 58 and 66% of associations said the demand for nursing, the demands on nursing are going up. Noticeably, no one said that there had been a decline. At the very best, it was little or no change, but the vast majority said it was going up. Go to the top of this slide, table 3 in the right-hand corner, and we said, do you have the nursing workforce capacity to meet the current healthcare needs demands of your country? The results are there by income setting. The bolded numbers, they're bolded because they're the highest scores across those different categories. But I will take you to the overall score in the top right-hand corner, 38.2%, saying that their country was poorly or very poorly prepared in terms of nursing workforce capacity to meet those increased demands. So what we have, colleagues, is a growing gap in between the supply of nursing workforce and the demand for nursing and healthcare. And figure 8, the bottom right slide, you can see again the significant scores between 35 to 63% saying that gap has widened over recent years. Next slide, please. So we then ask for some key indicators to tell us about the health of the nursing workforce, inflows and outflows. I haven't got time to share all of these with you, but we've just chosen a couple. Firstly, figure 5 at the top is, has there been a change in the number of undergraduate nursing applications? Very interesting to see that the biggest number of increase in applications is low income countries, 73% saying, yes, there's been an increase, but only 16% of high income countries. This report covers the issue of international migration and recruitment, and this finding is particularly relevant to that section of the report as well. Interestingly as well to note that high income countries having been the smallest increases of nursing graduates, actually 29% have seen a decrease in the production of nursing graduates. We then ask, what have you seen in terms of numbers of nurses leaving the sector? And figure 7 at the bottom of this slide. And you can see again very significant results between 40 and 57% of countries saying there has been an increase in the number of nurses leaving the sector since 2021. The overall average is nearly half, 48.4%, talking about saying that they have seen an increase in numbers of nurses leaving the sector. Important to point out, this is the observed leaving rate from national nursing associations. It might not be that these people have actually left the register in their country. So if you just look at the numbers leaving the register and you see that they are lower numbers, that may well be because people have left their nursing jobs, that's what nursing associations are reporting, but haven't as yet made the decision to leave the register. Next slide, please. We then dug down into some real nitty-gritty issues around pay and conditions. We ask, has there been a real change in the base nursing salary since 2021. Real change is important because the analysis here is based on something called PPP. So this adjusts for pay after inflation and cost of living. So it gives you a real sense of whether nurses feel better off or whether they feel poorer. I think figure 10, the first graphic that you see at the top of the slide, between 25 and 41% of nurses who are saying they have experienced a decrease in their real pay. Those figures are higher, I think, than any of us probably anticipated. Vast majority of people have stood still, and there's only a very small number there that have actually increased. Important to say, this is a finding that is echoed in OECD work as well, showing stagnation or a decline in the pay of nurses in OECD countries. We then said, does your country have plans in place, national plans, regional plans, local plans, to address these nursing workforce issues? Bottom graph here, table 6, I'm just going to take you to the overall result for national plans. 51.5% have a national plan in place. That, I think, is very significant and worrying as well, that nearly half don't have a national plan in place. Next slide, please. We then ask people about whether, if they had a plan in place, if their country had a plan in place, does it align to the strategic directions, the global strategy for nursing and midwifery? There's some very welcome news in this slide, because there is only one country that said that their national plan didn't align to the global strategic direction. So that's very, very encouraging that there is alignment with the global strategic directions. But we then ask a more detailed question. If you have a plan, basically, how closely aligned do you think it is? Is it really aligned very, very closely to the strategic directions, or only a little or a moderate amount? The biggest scores, the highest scores are in bold again. You can see there's a mixed bag from 37 to 53%. But I think what this tells us, even if people say there is alignment, it's not necessarily a strong alignment to the strategic directions as we would want to see. Next slide, please. We went on to have some questions focused on retention. You've heard about some of the recruitment issues, not enough applicants coming in. We talk a lot about recruitment, but you've heard from ICN that actually we think we should probably be talking even more about retention and then recruitment. These results are some indicators that point to the effectiveness of retention. We ask how well nurses felt they were supported to work to their full scope of practice. Again, I'll just take you to the overall result in table 10, top right-hand corner. Overall, how well you felt you're supported? Only 41%. We know that this is an issue around the world. ICN has worked with a number of nursing associations to support the introduction of frameworks and legislation for advanced practice, for example. We still have a lot of work to do here, colleagues, with 60% not strongly enough supporting advanced practice. Tied to that, the next question is about what opportunities are there for career progression? And again, you can see the range of results, how well supported are the opportunities for career progression, but again, at or below 50%. So these are indicators of real work, important work that needs to be done to strengthen retention of experienced nurses. Next slide, please. And then we went on to ask about other key policies affecting nurses. Go to the top right-hand corner first, the table 14. This is where we ask about the exposure to violence from both patients and the general public. I'll just take you to the overall results at the bottom. The overall result about violence from patients or the public, 86%, from other employees 71%. We know that there's other data from other sources showing hugely worrying high levels of violence, and the fact that it's not just from the patients or the public, but also from other staff as well, I think is very significant in this in this result. So we then said, tell us, given some of these issues around your retention, safety, violence, do you have policies in place to ensure the safety and well-being of nurses? Go to the left, bottom left, sorry, no, back, figure 12, the bottom left of this slide that you're looking at now. The policies that people say that they have in place for preventing workplace violence. 31% have no policies, 48% no policies for new graduates, 52% no policies for access to mental health or psychological care, 64% no policies for the right skill mix, and 69% no policies for having the right staffing level. So this is a hugely worrying gap between the lived experience of nurses and policies simply not being in place. And that particularly, that one on the right staffing levels, is that a strong theme through the issue of violence, the experience of violence, is the relationship to shortage of nurses. A shortage of nurses creating frustrations for patients who are not getting treated quickly when they're with a sick, anxious, sick, unwell relative, but also frustration among other nurses and health workers about the huge demands and not having enough staff to deal with them. We then ask this other question to try and indicate, if you do have a policy, very basically, is it a good policy? Is it a policy that's enforced? It's got good measures in it. It's funded as well. This is table 13, gives you a sense of the association's assessment of the quality of the policies that are in place. And you can see again in the bold numbers that the biggest results are around, fair and below 50%. So even if we do have a policy, it may not be as most robust and strong a policy as we would want it to be. Next slide, please. Why does all of this matter? The absolute bottom line, asking NNAs their assessment is, are nursing workforce shortages affecting the delivery of safe care? You can see the results here, again, graduated from strongly disagree to strongly agree. If I take you to the overall results of those who agree or strongly agree, 38%, 38.8%, 25.4%, 64% of associations agreeing or strongly agreeing that shortages are affecting the delivery of safe care. Next slide, please. So where are we with global nursing shortage? You know from the State of the World's Nursing Report in 2020, the shortage is 5.9 million. In just a few days' time, 12th of May, we'll have an update on that figure, along with the whole of the next State of the World's Nursing Report. But we know as well that there are others. There are others who have done serious academic research, who have the University of Washington's work, who have predicted that actually the shortage could be as much as 30 million. If we're more ambitious for global health and access to healthcare, the gap could be up to that number. But what we also know from WHO, that they have recently adjusted upwards their overall shortage for all healthcare workers from 10.2 to 11.2 million. So nursing comprises about half of the global shortage. Next slide, please. So just to try and summarize and pull together here, what we're seeing, clear increase in demand on nurses, insufficient compensation, lack of retention, effective and robust retention measures, plans that are in place not widely enough. They may lack a focus on retention. There's significant gaps around violence and staffing levels as well, putting this huge and additional strain on our nursing workforce, feeding through boasting to not enough nurses coming into the profession, but also more nurses who we see are leaving us with this gap between supply and demand. Colleagues, we've likened this to a little bit if you're driving your car and the hidden airbag that's there in terms of if you have a crash, if there's a disaster, it will inflate. The politicians probably have taken the nursing profession as for granted in terms of it inflating when we have crisis, when we have high demand. These results, I think, caution us that nursing response, that nursing airbag may not inflate in future emergencies to the extent that we would want it to. And we are also seeing some policy responses which frankly we think are the wrong responses, turning over-reliance on international recruitment, looking to try and reduce the length of nursing education as well. Next slide, please. A whistle-stop tour, as I said, but the people who did the really hard work on the analysis for us was Greg Sharplin and his colleagues from the Rosemary Bryant Research Centre in Australia. Greg, on behalf of us all, firstly, huge thanks to you and the team for a fantastic piece of work in terms of pulling this together. I hope I've done the results justice, but I know that you and colleagues, as well as seeing the hard numbers, also read a lot of the narrative that came back as well. So I'd really welcome your thoughts and your comments in terms of someone who's read through all of the responses that have informed this research. To you, Greg.
Yeah, excellent. Thank you, Howard, and thank you for the kind words. And also, I suppose, firstly, to acknowledge and thank those national nursing associations who took time out of their schedules to prepare the detailed responses. Like you said, it wasn't just the quantitative data we saw, but the detailed commentary that helped to bring to life some of the real challenges that are emerging at a country level, whether it's at the high-income countries or the low and lower middle-income countries. I think that the comments generally reflected the data that you showed, Howard, and that first and foremost, a collective theme emerged across the report that there are persistent workforce challenges that continue to threaten the sustainability of the workforce and those numbers that we're trying to achieve to address universal health coverage. These can be seen through challenges regarding the requirements for education of new nurses or the challenges regarding recruitment and retention. So, for example, there were a number of comments regarding the burnout associated with nursing and the particular kind of on-the-floor challenges, the real day-to-day challenges that nurses face, and how that can be exacerbated by exposure to hostility and violence towards them. There are also challenges related to patient, or how this affected things like patient safety, which you mentioned towards the end there, and really that's the end goal of what we're trying to achieve, both from a policy level, but also the day-to-day practice of nursing is about trying to improve the health outcomes of people, and they can't achieve this when there are those real life experiences they face. The policy data that you showed, again, was reinforced in some of the comments related to lack of protections, related to mental health challenges or physical health threats, to supporting new graduates, to having the right staffing levels, in particular staffing levels, and how this was making it a particularly difficult time for the profession, especially in increasing kind of complexity of healthcare. I think finally there was commentary regarding how importantly national workforce strategies can be used as levers to improve those working conditions, and how they really present as an important opportunity for countries to bring together what we see or we know as gaps and try to use that as leverage to to improve the working conditions, whether it is related to pay or protection of rights as employees, or whether it is to put in place, I suppose, strong policy to protect the migration of nurses, because as came through in the report and perhaps not touched upon as much, but we're still seeing a challenge emerging or kind of shown in the report around trends towards low-income countries losing nurses to high-income countries. So again, I think that I would urge listeners to take the time to read through those comments, because I think that they would largely see what is said there reflected in their own country. Again, thank you for the opportunity to be able to bring some of this report to life. It's been excellent.
Thank you, Greg. We truly appreciate your insights on this. And as you've mentioned, and as Howard have mentioned, there is a lot of rich data and additional information in the report. And this is why we thought it was so important to be able to get the real on-the-ground information. So we really encourage everyone to read the entire report. We'd now like to present the results of the International Nurses Day Caring for Nurses Strengthens Economies report that also is we're releasing today. And if we would go to the next slide, please. You're going to hear from Dave Stewart, our Director of Nursing Practice and Policy, as well as Jillian Moore, our Communications and Policy Consultant. And as you know, with each International Nurses Day publication, again, we bring strong messages to influence our policymakers as well as other leaders and change makers. And we want to bring to their attention once again, there is a crisis in nursing well-being and the workforce. You've heard the challenges. Some of this was not a new information, but in essence, it is a call to action. So we want to stress the need for investment in caring for nurses, because this is important for all of our countries, the health of the people in all of our nations, and for the overall nursing workforce. Dave, over to you.
Thank you very much, Pam, for that introduction. And thank you, Howard, for the discussion around the health workforce challenges. So you've heard about some of those key workforce challenges. I want to bring that back to how that actually relates to nurses and how it has impacted them across the world. 20 years ago, I was working in an elective procedure place in a different country. During that period of time, I remember a young man of around 40 who was married with 2 children who were just sitting outside of the procedure room. During that procedure, there was a mistake that was made and it was picked up quite late. And unfortunately, after a long period of resuscitation, our attempts failed. I still remember to this day the family that was sitting outside of that room. And I still remember the CPR components. As a profession, we work with people in their most vulnerable moments of time. It is when things go wrong, and even when things go right, the emotions still stay with you. The experiences still stay with you. It's a human connected profession. And with it comes a significant amount of challenges, number of hardships. And in that, it does impact the profession, and we will look at that in many different ways. We know that nurses around the world are experiencing significant amounts of burnout symptoms. And this is a severe level. We are not talking about average levels. We are talking about severe levels of burnout symptoms. And this was even higher during the pandemic. And of concern is that many nurses have witnessed patients either die or have extreme events due to working conditions. And this has a major impact on moral injury of nurses around the world. As a result, there is a large proportion, 50%, of workers who regularly consider leaving their jobs. And 80% are working over their capacity and working more than what they are expected to. And if this wasn't bad enough, it is not seen to be an asset. In fact, many nurses report that their salary is not enough to keep them out of poverty. What we also have found is that conflict and workplace violence is becoming almost acceptable, with huge amounts of nurses experiencing this. And even worse, we know that in 2023 alone, in conflict and humanitarian areas, there were major attacks of violence on healthcare facilities and workers. It is considered one of the most risky professions. Those that are there to care and to protect health, promote health, and provide dignity at the end of life. This is a workforce that is often on the front lines of harm. And this is absolutely disastrous. So when we have a look just at some of the basic challenges, we think, how is this being treated as an asset? How is this investment really being looked at? And in addition to that, we also find that many nurses are always, a lot of them are saying that they're overskilled, that they're utilizing their experiences, their knowledge and capabilities are not being used to their full extent. They're being undervalued. So if we just go to that next slide, thanks, Cyril, that would be helpful. So what does this lead to? We know that the OECD has been conducting studies about students and their interest in pursuing nursing as a career option. And this has seen a marked decline in almost 50% of countries. So less students wanting to study nursing as an occupation. It leads to an increased exodus from the workforce, causing significant retention issues and turnover issues. But one of them is also the lowering of productivity, which also costs the economy significant amounts of money. And this ultimately affects the health of entire populations. And the type of fixes that are employed just don't work. They are temporary, but end up causing longer term, more complex challenges in the long term. And they tend to focus on the quick ramping up of international recruitment, which does cause harm in different areas and different levels. We also know that there's employment or task shifting to less skilled or qualified workforce, and instead of nurses. And we also seem to focus on just the supply issue. We've got to just educate more and more people instead of addressing the key issues around retention. And so there's that focus more on increasing the casual workforce and the non-permanent workforce. I'm going to pass over to my colleague Gillian, who's going to just look at the economic impact of such requirements. Next slide, please, Cyril.
Great, thanks, David. So in researching and putting together this report, as David highlighted, the data clearly showed us the extent and the wider impact of these challenges. But it also showed us that when we do invest in nurses' well-being, we get a really strong economic and social return on that investment. And that comes in the form of a healthier, a more stable, and a more productive nursing workforce. And that translates to improved health outcomes, to improved patient safety, more effective health systems, and ultimately that's going to support healthier populations who can then fully contribute to their societies, to their professions, to overall economic growth. And so to put some numbers on that, so on the top left here, we know from McKinsey and World Economic Forum data that investing in employees' health and well-being has huge economic returns. And based on their figures, specifically investing in nurses' health and well-being could create $100 to $300 billion of value. And that's by supporting nurses to maximize their contributions to health systems, supporting them to be as effective and as productive as possible. But because nurses support the health of all people and professions, that economic return can be much greater. And the figure for improving overall workforce health and well-being has been set at $11.7 trillion, again by McKinsey and the World Economic Forum. And we know that nurses are a really fundamental part of supporting that wider workforce health. On a global scale, then, we know that poor health costs the economy 15% of gross domestic product every single year in lost productivity. But the research is telling us that if we improved population health, we could actually add $12 trillion to our world's economy by 2040. So those numbers are really telling us that nurses are key to enabling populations to thrive, to creating both health and wealth for all. And the research really shows us that spending on health is a smart strategic investment. Every $1 invested in health has a return on investment of at least $2 to $4 because it increases the costs of ill health. It decreases the cost of ill health, the costs of care, the costs of time off work, and it increases populations' productivity on the whole. And we've actually seen even higher returns than this in many cases. So just on the top right there, looking at a couple of initiatives specifically to improve nurses' health and well-being. We have some examples like a program supporting nurse health in the Netherlands, where we saw that every single euro invested brought 5 to 11 euros in economic return because it reduced absenteeism, it reduced presenteeism when people were coming to work, but they're either not well or not able to be fully productive. We've also seen, for example, a case study of a peer support initiative for nurses' well-being that saved over $20,000 per nurse, with those savings coming from reducing absenteeism, but also reducing turnover, so less people leaving their jobs. And if we can move on to the next slide, please. And so the World Health Organization also tells us that we have a huge economic and social opportunity in improving the health, safety, and well-being of health workers. And so in our IND report, it was really clear that supporting nurses' well-being and caring for nurses is the path to a range of outcomes like improved patient safety and lower rates of medical error. And that's currently 12 to 13% of global health spending. So improving that is a potential saving of $606 billion per year. We also know it improves health system productivity and efficiency. It saves on the cost of occupational harm towards nurses. And these are really strong numbers that make a strong economic case for caring for nurses. But of course, they're never just numbers. Behind all of these numbers, there are millions of real patients who could receive safer, more effective care, real nurses we need to support and enable to deliver that best possible care that they want to deliver and that they've been trained to deliver. And we know that supporting nurses' well-being would also improve job satisfaction for nurses. It would decrease turnover, improve retention. And we also know that investing in nursing is also the path to delivering cost-effective primary and preventive care, which the World Health Organization has said is the path to making care accessible for all, to universal health coverage. So overall, what the research is telling us is that caring for nurses has a huge multiplier effect by lowering all of these costs and bringing us so many gains, improving the health and productivity of health systems and entire economies. And so we know that with will and with investment, there are solutions. And I'll pass over to David again to discuss those.
Yeah, thanks, Gillian. And that is such a powerful case, just the economics behind treating the health workforce as an asset rather than as a liability. One of the amazing visions that Dr. Pam Cipriano has pointed out since the beginning of her presidency is trying to move the conversation from nurses being invisible to invaluable. And part of this, of the work of ICN over these last several years, has been really to highlight some of these key challenges and issues and potential solutions to this. And so we have had a suite of works, including the Caring for Nurses Agenda for Sustainable Workforce, which is the current one, but also our Sustain and Retain report and our 125th anniversary declaration on the future of nursing. Underpinning much of this work, though, is when the board led work on the ICN Charter for Change, which focused on the policy interventions for stronger health systems. It has been used today, and you can go onto social media channels like YouTube or others, and you can see how nurses are using these in different platforms, how educators are using them, how they're being used in celebrations. But they're also picked up by health ministers as part of their parliamentary speeches. We estimate that the audience, particularly for the Charter for Change, reached up to about 200 million people. So it is getting seen, and we want the public to keep hearing and understanding these issues. Next slide, please. One of the challenges is why do we focus on this? Why should anyone invest in the health and well-being of nurses? Well, there's three clear arguments. One, there's an ethical responsibility. One, it's legally necessary, but it's also economically sound. And so we've provided you with the evidence for that. But what has been pointed out is that there is not just one particular issue. The metaphor, the straw that broke the camel's back, is used to describe that even minor events or actions can cause longer, more significant breakdown or a collapse after a series of events. What we find is that there continues to be a buildup of many, many challenges on nurses. And in fact, there was work that was done by Stolenki and Carlton who pointed out that on average, nurses have 17 potentially psychologically traumatic events. These tend to add up over periods of time. And so the solutions aren't necessarily there as one simple thing to solve all of the major challenges. And in fact, when we look at the word caring for nurses, it's actually an extremely powerful word because we want it to be a holistic approach, not just a piecemeal approach taking one little element. Next slide, please, Cyril. Throughout the report, we've provided a number of effective solutions to this, things that we know work exceptionally well. One of the most important, obviously, is the work around evidence-based staffing levels or safe staffing levels and the optimal use of skill mix. The work by McHugh and Aiken and Emery Rafferty highlight this work. That research has been known for a very long period of time. We know that there needs to be more real-time monitoring and dynamic adjustments to this. But we also recognize that often nurses are just not provided with the right resources and equipment to do their job effectively. And in fact, often the technology that is provided doesn't actually reduce time, reduce inefficiencies. It actually adds more time, more duplication of effort, and actually takes nurses away from the patient. It is not designed by nurses for nurses. And so often we're given the wrong type of resources to appropriately care for our patients, leading to increased moral injury. But also there are key issues around safe and decent working conditions, where we see continuing escalation in violence levels, and instead of addressing zero tolerance or that promotion of healthy work-life balances, being able to access protective equipment. Nurses are often undervalued in terms of their access to professional development or involvement in decision-making, or even career pathways and leadership opportunities. And so addressing some of these core challenges actually provides a more enthused, more retained workforce that can actually be valued and seen as an asset. Instead, if we go to the next slide, instead of high-performing cultures, which is something that the magnet addresses, high-performing cultures, we see leaders who try and suck the marrow out of nurses, just demanding more and more, instead of trying to care for those who are caring. And so it's almost like the burden keeps getting added and added, where innovation is seen as conflict instead of what it really is challenging ideas, coming up with new progress and new ways of doing things. We also, as nurses, need to look at supporting one another, our own nursing leaders, and supporting and encouraging each other. One of the challenges that we have is that we always think that it's somebody else's problem. But I think we all need to understand that we are all part of the solution, and how we care and how we nurture the next generation, but also for those that we care for in our leadership positions, who are often on the front lines of raising their heads above the parapets as they try and make change for those who come behind. But there have been exciting innovations around many different countries where we see practical examples of nurses' health clinics are being established in many different countries, where health services for nurses are being established. These are developed by nurses for nurses and being accessed by nurses around the world. But most importantly as well, and that even though we highlight this last, we need to make sure that the skills, the knowledge, the experience of nurses is valued, particularly through fair and competitive compensation. To have nurses who are struggling to meet the basic standard of living is unconscionable. And it is an absolute tragedy that we do not treat the largest health workforce as an extremely valuable asset. So I'd like to pass back to Pam and thank you for the opportunity to present on our report.
Thank you, Dave and Gillian. As you have heard, there are so many compelling reasons for the need to care for our workforce. And we've highlighted a lot of the challenges, but at the same time, we know it's important to highlight that the solutions can be put in place. And so I want to turn to the ICN First Vice President, Lisa Little, who's going to share a case example from Canada. Lisa?
Thanks, Pam, very much. Yes, so Dr. Lee Chapman, our federal government chief nursing officer here in Canada, has done a wonderful job of leading a compilation of Canadian current and leading retention strategies centered on 8 themes to foster knowledge transfer across our country. But I would, of course, suggest that this retention toolkit that's been developed and is publicly available has applicability around the world. Through this process, she has brought nurse retention to the forefront in the eyes of nurses, policymakers, employers, and others. And I believe she has united nurses with a renewed energy and focus through her very broad consultation and input from nurses from coast to coast to coast in our country. The task remains still for action, but I think we're beginning to see some uptake on that retention toolkit here in Canada. One of the key elements in there as well is, as we've heard today, about violence in the workplace. And it is a significant issue in Canada. And as you will see in the 2 reports that were released today, it's an issue around the globe. And one of the items in the toolkit with some suggestions on how to address that. Many organizations have a zero tolerance for violence policies, but unfortunately, they're not adhered to. And unfortunately, violence in the workplace has almost become the norm. And I think some nurses and employers have become complacent, thinking this is just the way it is now. And I think part of that, as you heard from Howard, is frustration from the public since COVID, short staffing, etc. But no level of workplace violence is acceptable. You know, we need every nurse to be reporting workplace violence, and we need system accountability in terms of public reporting and public education about the levels of workplace violence, and so that the people are aware and nurses are aware when they choose different places in terms of working. And lastly, I would say that the Canadian Nurses Association has actually gone so far to include workplace violence, and particularly against healthcare workers and nurses, as a key priority in their election toolkit for our current federal election here in Canada. So there's lots of resources out there, I think. There's an opportunity, and I think sharing lessons learned and what works in various areas is a real opportunity that we have before us. Thanks, Pam.
Thank you very much, Lisa. Again, it's important that we focus on the fact that our support for all of you and for our national nursing associations is to be able to implement change, influence change, because that's what's really critical. So next slide, please. I want to just speak briefly about what's coming up. And again, we know there have been a number of questions coming in. So if you still have questions, please go ahead and enter them. I know we will not have an opportunity to answer everything, but next slide, please. We want to remind you that on May 12th, the WHO will issue the world's second State of the World's Nursing report. We're very much looking forward to this. This will build on the 2020 report. We really need an update in terms of what has happened to the workforce over these very critical 5 years. And so we will understand changes in employment, changes in migration, looking at attrition from the workforce, and then understanding what has changed in the environment. So this is a really critical time, and many of you may have seen an announcement about the webinar that will occur on that day. Otherwise, information will be forthcoming. But we also know that, again, if we could go to the next slide, that what accompanies the State of the World's Nursing report is a supporting implementation plan, if you will, which is the global strategic directions for nursing and midwifery. And you've heard some mention of that. There is also one of the 4 critical areas of focus called service delivery. This is where it has been embodied in the strategic directions for the last 5 years, that we must care for our workforce. We must address the work environment. We must address pay. We must address all of the issues that support a well-functioning healthcare environment, healthcare team, and certainly nurses and midwives. We anticipate that there will be an extension of the global strategic directions that will accompany the State of the World's Nursing report. So we anticipate that this will be, again, a significant addition to the data that we're providing, but also certainly recognizing that this requires a lot of work for all of us for future implementations. And I want to be sure that everyone knows that we have the ICN Congress coming up in Helsinki, June 9th to 13th. Hopefully many of you are already signed up, and we will see you there. So I know we just have a few minutes if we don't run over, but I wanted to go to the questions and answers. And again, just reflecting, we can't address all of them. We've had questions about gender inequality, staffing ratios, policies, and how is ICN truly influencing what's happening. But let me just sort of synthesize a number of these questions, and I'm going to ask Howard Catton to please respond. And so these questions really deal with how do we really move policies about workplace environment? How do we get our countries to act on reduction of violence? How do we make sure that we can influence, whether it's staffing policies or, again, all of the protections that we need in the workplace that are so important to reducing burnout, to having nurses feel protected? I mean, you heard very passionate assessment of where we are with the number of things that must be improved in order to retain nurses, in order to keep them healthy. So Howard, maybe perhaps if you could address in general, what is ICN doing, and how can our work continue to inform and support the action in our NNAs?
Thanks very much, Pam. So we are trying to firstly bring forward evidence, real hard evidence of the health impacts and implications of not investing in nurses in the nursing workforce, plus the economic evidence as well. So it isn't just seen as evidence that's self-interested on behalf of the profession, but we make the connection with the ambitions the world has for improved global health. And for those policymakers who are perhaps even more concerned about the money than they may be about health, that they see that there is absolute economic benefit as well. But that evidence needs to be taken into policy and advocacy. As was clear, even if we have a policy, it might not be a very good policy. It might not be a very effective policy. It may not be a funded policy as well. So we need to follow through that the policy is in fact implemented. And this is where nursing leadership is so critical and so important, that if the nursing leadership voice is missing from those policy or political decisions, then people are making, we say they're flying blind. They're making decisions without the evidence and without the expertise. And the invisibility absolutely we have highlighted how significant gender inequity, the fact that 90% of our profession are women, is as a key contributing factor in relation to invisibility, lack of leadership positions, not seeing the economic value of what nurses and the profession deliver. And frankly, the ambitions to improve gender equity across society, I don't think you can do that without nursing, because we're 29 million strong. So what we have to do is to make sure that we follow the evidence, from the evidence through to the policy to the decision making, with effective and high profile leadership. And last point, we do it together. Our founder said there is solidarity through strength. If we have different voices or perspective on some of these big issues, it makes it very easy for leaders to dismiss us. So we need to come together on some of these big evidence questions, these big policy asks, these big issues of implementation, and work together to ensure that they're implemented and deliver. Back to you, Madam President.
Thank you, Howard. I think reminding us that our work together is what is so critical, because that's where we increase our influence. So what you've heard today is a presentation of significant evidence, as Howard mentioned. This is really a key time, a key opportunity for taking action. I mean, call to action shouldn't be a phrase that we just take lightly, because we know that this work to support nurses, as the saying goes, this is a marathon and not a sprint. So we know it doesn't change overnight. This is something that ICN has been working on for some time, as have many of you. And so as we continue to progress and have important information and data to share, that just strengthens our ability to influence change. So this is something where all nurses really need to come together. And it really depends on us to make sure that we can affect not only the health of nurses, but ultimately the health of our nations. And I believe we continue to equip you with more and more valuable information to be able to make those justifications and have those influential discussions. So there is urgency. We know that the growing shortage in many of our areas, or maldistribution or lack of funding for nursing positions, and issues of migration continue to affect the nursing workforce. But it is the broader issues, the context, the environment, that we're also stressing in these reports to say we must work together. We must take action to make change, one issue at a time, or as many as we can together. And so we know that it's important for us to take this information and make it our campaign for the next year and into the coming years, to make sure we are not neglecting these really critical issues. And ICN will continue to do its part in amplifying the solutions, as well as continuing to bring information to bear. And as we work with our influential organizations and partners and bring this message to countries, to the World Health Organization, to the United Nations, we will continue to sing your praises and recognize the extraordinary efforts that all of you make as nurses and leaders in your countries. I want to thank all of our presenters today, and I want to thank all of you who have attended. I hope this continues to be a very strong message that you can bring forward, and we look forward to working with you to address many of these challenges so that we continue to see more and more progress into the future. Thank you very much, and we look forward again to a very productive International Nurses Day on May 12th. Thank you.